I'm Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with the patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with the lifelong medication. Here we learn of the approach for a patient who had allergy and skin lesions. Started at neonatal period, now he is 26 years. His problem is itching all over the body with darkening of the skin, scaling and oozing or the weeping lesions also. He is disturbed when sleep is there because of the itching, and he is very stressed because he is not able to focus on his studies or he is not able to focus on his job also now. He is having scalp lesions also, and his scalp is balding also. Hair loss is there and also the balding. And hair loss is there actually all over the body. The skin of the leg and hand and all, the skin is almost nil actually. But a scalp, that much problem is there, but balding is there. He's on anti-allergic and immunosuppressants. Here I will try to explain how long it took for multiple medicines to be reduced and stopped. How long it took to get relief from symptoms and progress evaluation based on corresponding improvements in periodic tests. When we come to the details of the disease and the patient, this is a male, 174 centimeter height and a 60 kg weight. His age is 26 years. And when we come to the symptoms, his major problem is itching all over the body and the darkening and scaling of the skin. And also there are when he scratch, there will be eczema sort of lesions. Actually, we can't tell whether it is psoriasis or eczema also. Both parts are there. There are some scaly lesions, we generally take it as psoriasis, and weeping and oozy lesions of the skin usually take it as eczema, that is atopic dermatitis. This is a combination of both actually. Actually, his father is telling it is started at birth itself. Actually, for him, it is maybe in the neonatal period it is started. From birth, it is the problem is there. He's telling even the ear hole is there, no? That also is affected actually, and all the private parts, everywhere the lesion is there. And the child, because we can understand the child is suffering, the parents has tried so many treatments actually. Modern medicine, definitely multiple skin specialists they have approached, and also in India we have other mode of treatments like Ayurveda, Unani and all they have tried, and they tried homeopathy also. But for the last 26 years the child and the parents were suffering because of his symptoms actually. So when we come to the disease category, it's an allergy and autoimmune disease. It's a combined allergic and autoimmune disease, and it is very common among the children, and even it can carry over to the adulthood also. Even there are patients who are starting their this sort of eczema and allergy and all in a later life also, when in 30s and 40s also. So for him, it was from the birth it was there. When we come to the medications, he is now currently, he has tried all the different systems and all. Now he is using Visalon, that is steroid is also there, and also some anti-allergic medicine, Vilasho and Atarax he is taking. Then when we look into the blood test result, he was very low vitamin D, 5.5 as 27 only. And we can understand his skin is damaged. The skin is not able to make any vitamin D, even he exposes to some. And he's not on any, given any vitamin D supplements also. So it is very low, 5.27 only. And his triglyceride, when you got into the cholesterol and the triglyceride is high, and uric acid is high. That may be because of this turnover of the cell that we can see with many of the sort of psoriasis and sort of diseases. So uric acid will be high, and yes, that's an inflammatory marker. and WBC, and also the platelet is also high, maybe because of this itching and continuous irritation and the blood clotting factors, and the platelet may have to be more there. And IgE level, that is an inflammatory marker or the allergic marker, that is also very high, 1492, it's almost 1500. And when we come into the intolerant and allergy tests, he's allergic to many common food, like even rice he's allergic, oats, yeast. That is, yeast is used in Kerala. The preparations, we have a favorite dish called appam is there, that is we are using yeast. And also in this bread, and that also this bakery items, everything it is used. So he's allergic to brewer's yeast, lemon, mushroom, tomatoes, even olive. He's, I don't know, we are not using olive here commonly, but he's showing allergy to that. And many fruits, potato, orange, some vegetables, and it is many things he is showing. Even spices like cumin he is allergic. And the Kerala we use a lot of coconut also, that is he is allergic to coconut. And coffee and so many items. It is actually this sort of allergic reaction is very individual. So it will be, each person it will be different. So there is no meaning in going to elaborate his allergic reactions. Next we come to the symptoms. His problem is itching and scaling. Itching is there, oozing part is there, and the skin lesion is his problem, and itching and the burning. When he itches, there is burning sensation and not able to sleep, stress. That is his problem. When we come to clinically supported lifestyle correction for such patients, what we do is to ensure all the nutrition in the food, and if there are 57 nutrients is needed, or including water and oxygen, 14 vitamins, 14 minerals, around 20 amino acids and 4 fatty acids, and dietary fiber. So what we are trying to ensure is all the nutrition should be there, but minimize toxins like this color, preservatives and all. The food should not contain such things. That is what we are trying to do. And also stimulate the body, stimulate the immune system. To stimulate the immune system, what we have to do? Immune system is lodged inside the bones. You have to stimulate the bones. Then only immune system get activated and normalized. This is an autoimmune and allergic disorder. In that immune system is derailed actually. They don't know who is front or who is the foe actually. And even in autoimmune disease, even the immune cells are attacking our own cells. In this case, skin disorder, it is the skin is attacked by our own cells actually. If it's another autoimmune disease like rheumatism, the joint is attacked, rheumatoid arthritis syndrome, or even in interstitial lung disease, the lung is getting affected, or our own immune system cells are going and attacking the lung. That is what is happening. See, basically we should understand that how our body is made. It's from the food, the nutrition we are eating. Basically it is because primarily it is actually our immune system is working against some nutrition from food we are taking is not tolerant for our immune system. So we had to reduce. That is what also we are trying to do. Give optimal nutrition, and other things we are eating also to be only the most tolerant food for the body, the ideal for the body. We should not be activating the immune system. That is what we are trying. And give exercise. Exercise, the immune system is, as I said, it is inside the bone marrow. So if you want to stimulate the bone marrow, you have to do exercise. The only one part of the body which we can do voluntarily is the skeletal muscles. The skeletal muscles is attached to the bones actually. So when we do the exercise, the bones are stimulated and the immune system, that bone marrow is stimulated, and bone marrow get more oxygen and nutrition, then we can correct the immune system. That is what we are trying to do in this. Now, after starting clinically supported lifestyle correction, what was the result actually? And itching was actually on the 8th day, he's saying that 60% is reduced, and scaling 70% is reduced, and itching 15th day it is 70% and the 30th day it is 80%, and by 60th day he doesn't have much itching at all, and the scaling also is gone. And he is very comfortable. On the 8th day itself when he comes, he is able to sleep, and that itself make a lot of difference. Sleeping is essential for the immune systems to function. So he's without discomfort he is able to sleep. For the skin diseases, along with the food, what your oral food, we apply body care lotion also. That is also very high in nutrition, especially omega-3 and 6. Basically omega-3 based, omega-3, 6 and 9 in a special composition with the fat soluble vitamin. That is what is applied. So it will act as a, it will, the skin is able to absorb it directly from the, when you apply on the skin, and also the remaining it will make a coat in the over the skin, so it is protective also. When there is an active skin lesion, we had to put 4 or 6 to how many times it is, when it is absorbed, again put it, apply it over, so that you can protect the skin till it is normal. Once it is skin normalized, then we can reduce the application, and to once or twice a day, that will be sufficient. But till the skin lesion is over, this local application of this protective nutrition is a must actually. That is actually very helpful in healing in skin diseases. Actually, after by 60 days, all the symptoms are over, skin is reasonably come to normal, and they, even from the 30th day itself, they are actually, then in Kerala, it is, they are coming from the north end of the Kerala. This Cochin is in the middle of the Kerala. So they started asking, doctor, next time we had to come, or the telemedicine consultation is okay. I said, we always encourage the patient to come, but if it is outside there for NRIs, and if you are staying in other country or other continent, they cannot come for each visit. But if it is in Kerala, we are always asking, or close by, if they can come, afford to come, then they should come. Because he is trying to get out of a lifelong disease, and he is suffering from for the last 26 years from birth onwards. So I have told them that give prime importance to this and forget all the other inconvenience and come. It's only 3 to 6 visits they have to make it. Or then we can reduce. Up to 30 days, anyway, they had 90 days, every month is a must. Actually, then the next visit also, he is following it very diligently and came. And by the 90 days, he is totally symptom-free. He says that he is fully cured. But when I deeply look into, there is some more things has to be there to be get corrected. Actually, in between, he has taken some intolerant food also. He is allergic to rice, but he found out he can take this white rice he can taste. In Kerala, we usually raise the parboiled rice, that is red rice, that is usually it is artificially colored with some chemicals. Maybe that is the reason. I found that most of the people, very good number of people are getting allergic to rice. But many of them can tolerate the white rice. But we always advise them till they are totally symptom-free not to take anything like that. But after symptom-free, they can start, if it is intolerant food also, they can start introducing it, but to a limited quantity, and see whether it is creating any problem. But when he came into 180 days visit also, he said he can tolerate white rice, but otherwise it's fully cleared of all the skin lesions, and he was very dark. Because of this thing, he is very dark actually, and but by the 6 months he's become very fair and very handsome really. When we come to the medication tapering off, actually by the 8th day when he came, he was not taking any medicine because he was very comfortable after starting this, and he stopped by his own. We are also giving actually he was advised to stop this steroids. Instead of that, we are giving slight anti-inflammatory and anti-allergic, but he stopped that anti-allergic also by himself. And by that, after that, he has not taken any medicines actually. What we have given also, he was tapered off by the 30 days. Then I actually asked him to take only if he takes some intolerant food or something like that, and if he get an attack, then recurrence, then immediately take this anti-allergic and anti-inflammatory together, and within 1 or 2 days it will stop. And for itching also, this skin nutrient skincare is there, and also some anti-inflammatory ointment also. There is only for the if he's doing some mischief to his body by eating some intolerant food, then if it appears, he can apply it, and not to allow it to progress, which when we start it, it should be stopped. This he had a triglyceride was high, that was corrected by 60 days, it is perfectly normal. This lipid profile was normal. His uric acid was slightly, it is continuing like that, but it is reduced and it come down to 7.8, but it was slightly higher. And ESR came down, and platelet and this WBC came down to normal in the 15 days. Next checkup itself, it was came down. Even the IgE level are gradually come down. It was 5,500 to, it came down to, by 90 days it has come down to 827 actually, but it will also taper, come down. Then when we come to what are the benefits for your body also, we should check into. When we started treatment, his body weight was 62.3, BMI 19.8. It's an ideal BMI. Actually, even though his body is normal BMI and all, he is suffering from the disease. And his abdominal circumference also 76 only, it is okay. And body age is only 18 actually. His fat percentage was only 10.3. So his 18 means that he's not that muscular or anything, and his proportion is okay, but is of a low normal BMI, and his height is 174 centimeters. So he should be around 60 to 70 will be ideal for him, and if you build up, he can up to 65 will be okay if he is doing reasonable exercises. And if he is body, if you want to build up muscle like six pack and all, he can go up to 75. Otherwise, if it is a moderate, if you are a techie or doing only this oxyflex and try to maintain your health, it will be, to maintain the health, it will be around 65 will be ideal for him. And by 60, when he come, he's only 63.4, it's ideal. And his BMI is around 21. And abdominal circumference slightly high, its ideal will be around 75 only, but it is increasing. And the body age has come to 23, is 26, that is ideal. That everyone's prime age is actually 24. After that, you start accumulating fat, and lean mass will start lowering unless you take care to do the exercise and take correct the nutrition. Don't take too much of calories and all. And his fat percentage also is 13.8. Everything is ideal. But when he came to on day 90, he has increased to 68.2. And BMI is normal limit only 22.5. And his fat percentage is increased to 17.3. He should keep his fat percentage between 10 and 15. And his body age has increased. Started showing accelerated aging, 29. He's only 26. 3 years of accelerated aging, because he is accumulating fat and he is not doing the exercise, because now he is symptom free. His skin is totally okay. So he started eating more and reduced on the exercise also. And again at 190 days, he has again increased another 5 kg, 73. I have warned him on the day 90, reduce it to 65 and maintain. And regularize, do the oxyflex regularly, but again he's increased to 73.3, and the BMI also, for an ideally Indian it should be around 23 is enough, and now it is 24, and abdominal circumference 85 increased, you should keep it below 75, and body age now increased to 34. So now he is for 8 years accelerated aging, and that is not at all good. And now fat percentage also is touching 19.6. When we consider these patients' benefits with the clinically supported lifestyle correction, basically he was suffering from his birth from this allergy and autoimmune disease, and within 6 months, actually within 60 days, he is able to overcome from all the symptoms actually, and that is without any medicines. And all symptoms, this itching, oozing, peeling, decreased sleep, and the stress, everything is gone actually by 13. Only thing, so from a patient point of view, he's fully happy and the parents are fully happy. Only thing he has to avoid some intolerant food, that's all. If he eats some sort of things like which is intolerant, he may get a slight thing, and he understand when each incident he learn more. That is actually our immune system, this itching and pain and all is protective actually. And when we take anything, when you get a pain, you have to find out. Actually, this pain, itching, burning, this swelling, all are actually the protective mechanisms. And for him, everything is as a professional. And up to 60 days, I was so happy. But the 90 days when he came, that is the third month, he started put on 5 kg after stretch. So that is a very bad thing, and I have warned him. But again he came with after 3 months, again he gained another 5 kg. So that is very disappointing actually. But all the other part is very encouraging. But I had told after that, told him to bring down his weight to 65 and maintain it. Or if he want to increase, then it should be muscle. And now he has increased his fat level to 19.6. He has to come down to below, keep it 15% fat. Otherwise, his accelerated aging can go very fast, and if he reach 80, he may be his body age will be maybe more than 40, and he can get other diseases like metabolic syndromes. Or even though he is not free from the autoimmune diseases, he can metabolic disorders. Already his uric acid has not come to normal. All other parameters we are happy with, but the uric acid has not come down. That is because of this problem. Actually, there is some metabolic problem is lying down there, but he is not following this properly. Otherwise, that would have been come down to normal. There is some derailment is there, but because he is symptom free, it is very difficult. That is also one problem. When the clinically started lifestyle correction, usually within 30 days the patient will become symptom free and also medicine free. Those who are suffering for many years, even the cardiac patients and severe angina, in this person there is itching and all, but usually the symptoms and the medicines will be over by 30 days. Then the problem is they will not follow not everyone, but some will start deviating from the ideal lifestyle. Especially he's only 26 and he is actually freed from the disease only now, and he's enjoying his food, and he has gone for a tour or something like that. That is why he's after this for the last 4 months he has trained 10 kg. So he's enjoying, that is all good, but don't forget after getting corrected also, you have to maintain that ideal lifestyle. Then only you can keep your body ideal, your health ideal. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Devara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.